If it's me, I got to go. Whoever it is, we just can't occupy the office and let the policy and the problem remain the same. I think you start cracking it there. You start by getting with our federal persons and saying some of the guidelines that are coming down are not really helpful in every area. Some of the guidelines coming down, they're not helpful in Baltimore City. They're not helpful in Prince George's County. What is helpful? The question is, how do you graduate students with skills, with life skills? How do you, if you have to bring vocation, we talk about this all the time. I don't want to talk about 2 vocational tech schools in the county. I want to talk about having some vocational training in every school as a part of the curriculum, because either you're going to leave and go to college or you have to get a job. And if you're not going to go to college, and you need some life skill to work with. That's what I keep, we keep pushing, and we keep trying to change the budget, and I'll need suggestions from you, but right now I'm fighting school board on financial literacy. I'm fighting the school board on the method of testing and the percentage of the evaluation that we put on that testing, and not on just reading, writing, comprehension, science, math. I'm just fighting so that we can get those up to par and get our students graduating with that. That's who I am.
Senator, one of the biggest expenses a business has is health insurance and things of that nature. Prince George's County leads the area in infant mortality. What can the state leaders do to bring together federal and local dollars to make sure that there is health literacy as well as financial literacy?
I serve on the Healthcare Finance and Delivery Task Force, Joint Task Force in the House and Senate. Let me start with where we are. Let me start with Prince George's County Hospital. We've heard this over and over and over and over again. Yes, we have Prince George's County Hospital, and yes, we've poured millions and millions of dollars into Prince George's County Hospital. The task force charged, legislative task force charged with making it viable and or selling it expired 2 weeks ago. It's still not sold. That's a major complex. I was on the board of Greater Southeast when it too had a multiplicity of healthcare centers. We're looking at whether we're going to sell that hospital or how we're going to make it viable, because here's what you have. On the one hand, you have indigent persons who can't pay, but somebody's got to pay. On the other hand, you have a Prince George's County hospital system that has some pieces that can be economically viable, but certainly not the hospital center itself. I'm struggling with Fort Washington Hospital Center where I am, very small hospital. They need to expand. They have to expand. And what they're getting now is the same in terms of paying people going elsewhere, right? And indigent people coming there. Well, somewhere you've got to pay the bills. That's just the way it is. If you ask me my approach is the following. The state can help by looking at Prince George's Hospital Center, by looking at Fort Washington Hospital Center, by looking at Doctors Hospital, for example, and helping to deal with the bureaucracy, Southern Maryland Hospital, Dr. Monty, Southern Maryland Hospital, because for years they've been saying to us, if we're going to survive, we can't survive this way. One, we have to become a research hospital. So how do you help us to do that? Two, we have to have some specialty. I know that one of the hospitals have been trying to get their certificate of need so that they can deal with heart transplants. They've got to be viable, and to be viable, they've got to connect with our educational institutions. They've got to connect with our research centers, because the money is not there from Medicaid or Medicare. Right? So if it's not there and you got a hospital that's going down, how do we help Prince George's Hospital to become a research hospital, number one? How do we help them to get their certificates of need so that in the areas in which they can be specialties, instead of taking everybody into D.C., into Washington who can pay because they don't have what it takes to become a specialist? And I use heart transplant, for example. That's one of the things that came across my desk. But they have other ways. And the bureaucracy that we have it's really not helping them. We don't have enough federally funded health clinics. I think in every jurisdiction, in every area, if you're going to talk about it, it can't be when you're at your worst, you go into the emergency room, and then you get a bill that says you got to sell your house if you're going to pay for it. We have to begin in our school, high school, junior high school, middle school, and our elementary school. We have to begin looking at what is healthcare maintenance. And to do that, we have to compete for those federal dollars that will bring in the clinics so that we have treatment centers. We have places so that, you either pay now or you pay later. We've got to have places where people have access to the health care. I don't know what the Obama, I think that he's on track when he says we've got to develop and deal with health care. We've got to have affordable health care. I think he's absolutely right. I'm not the expert in his plan, but I think he is absolutely right that if other nations can do it, we can do it. Federal dollars to put in clinics, help with our hospitals that want to become specialized in some areas so that resources can flow, connecting them as research centers and research hospitals, and getting the funds, endowment funds. Those are ways that we can connect. Lastly, connecting hospitals so that they understand they are all partners. How do we have a Prince George's County universal health care? That's a word that people don't like to use a lot, but how do we, but it's true. How do we connect their hospitals so that they understand that they are partners and that each can survive if they're able to find their niche, we move the red tape, bring the research dollars in, and then set up the federally funded clinics for which money is available. We just have to compete for it. We have to compete for it.
If I could just add on the health clinic
Yes.
front, I know that the Congresswoman as well as Senator McCloskey fought to get about 8 health clinics federally funded in the 4th Congressional District at least. So that's parts of Prince George's County and Montgomery County.
So where are they in the process with that?
I think the money goes down through the local government. So then it has to be.
Let me know as soon as they give the local government the money, right? So we can make sure it's, earmarked, right? And please keep me up to date on that, because that's what we're waiting for. We're waiting to look at the lower Prince George's County and southern Maryland, where we just don't have the kind of health care facilities that we need. And I look at it from my perspective. I also sit on the Medicaid and Medicare committee as well, trying to make sure that doctors are adequately, taken care of and paid, because they can't, go into debt, trying to be on a mission, because they'll be out of business as well. So ways that you all can help is, a lot of federal funding floats in there so that doctors are paid on time, that hospitals are paid on time, and they're paid by a rate that helps them to not always come out in the red. That's where I need some help. Okay? Yes, sir, and I'll take this.
Senator, in regards to small businesses, recently the governor stated that there was a 5K initiative for small businesses.
Correct.
Could you elaborate on that, discuss more in detail in regards to how that process works?
The Jobs Recovery Act, what it does, if you're a small business and you qualify and you've had to lay persons off, or you have positions that you just can't create new positions, but if they're already existing positions or persons that you've laid off and you hire persons, you will actually get a $5,000 tax credit for each person that you hire. Again, meeting the guidelines and meeting the qualifications. And so you get that through the state of Maryland. It is a Job Recovery Act, and that's about as much as we've been able to do in that area of being able to give some kind of tax relief. We looked at tax relief from a broader perspective. I know it was very controversial, and you probably had Senator Peters. I don't know if he's been here to talk about it, but one of the things that we try to do, if I can say that helps businesses, but then you have to look at, if no one has money to spend, it still doesn't help you, and you can't hire anybody. We did put through an amendment that required at least $100 to $1,200, which is all that we could do, of relief on the tax bills or residential tax bills in Prince George's County.